Muted.
Thank you for joining us today for the webinar on strategies for meeting DSCSA triggered business requirements, a regulatory webinar. Now, before we get started, we just wanted to cover some housekeeping items. First, this webinar is intended to be interactive. There will be polls presented throughout the session. Those answers would be able to be answered by clicking directly on your screen. We'd love for your interactivity. Also, you may ask questions all through the presentation. We'll be monitoring those, and Dirk will address those through a brief Q&A session at the end of the webinar. Also, information contained in this webinar is current as November 2016. We also would love for you to visit systech1.com/webinars to view upcoming webinars we have set up to launch. Next one is November 29th, as well as Dirk's Q4 regulatory, quarterly regulatory update on December 13th, which should be posted over the next couple of days. Lastly, we do value your feedback. We'd love to know how we can further enhance these sessions and these webinars to further please you. At the end of the session, a quick survey will appear on your screen. Nothing for you to do. It will just appear once the session is closed out by me. And we'll allow you a quick minute or two to just fill out a survey to let us know how we did. Now I'd like to present your presenter for the day, Mr. Dirk Rogers, Regulatory Strategist for Systech International. Dirk, take it away.
Thanks, Mira. Welcome, everyone. Just a few words about Systech. Most of you are already aware that we have been in business for 30 years now, and we are the only one company to deliver serialization, track and trace, authentication, and engagement systems that meet all known regulations around the globe. One of my roles here is to help keep our solutions up to date as regulations change. We are the proven innovator in our field. Definitely consider us the next time you need a system that meets regulatory and business requirements and beyond. Okay, in this webinar I want to explain the difference between regulatory requirements and business requirements. And then I will explain a new class of requirements that I'm calling DSCSA triggered business requirements. And I will provide examples of each of these. So let's get started. Most people on this call probably have a pretty good idea of what a regulatory requirement is. I pulled this definition from the internet. A product or service requirement that is imposed by an outside, usually governmental, agency that must be met by every product or service under the purview of that agency. The reason a business chooses to meet a regulatory requirement is so they avoid the cost of fines and other penalties. In some cases, not following a regulatory requirement might threaten the ongoing existence of the business by blocking access to the target market. If we get just a little bit more specific, we can narrow the definition of a regulatory requirement in terms of the Drug Supply Chain Security Act to a product or service requirement that is explicitly imposed by the U.S. statutes as the result of the passage of the DSCSA, and that must be met by products or services referenced under those statutes. The key here is that the DSCSA has lots of requirements that are explicitly called out. You can't avoid them because they are written right in the law itself. For example, the serialization of drug packages in homogeneous cases by November 27th of 2017 is an explicit requirement in the DSCSA, and we can point directly to the exact clauses that must be followed. Here is section 582A9, where part of the serialization requirement is specified. It's kind of hard to get around because it is spelled out so specifically. Here is some more detail on the serialization requirement. This one comes from section 581.14, where it specifies the contents of the product identifier that must be printed on the packages. As we'll see in a minute, this section lists the standardized numerical identifier, or SNI, the lot number, and the expiration date. So the question is, why do so many companies show a GS1 G10 instead of an NDC on their packages? In fact, my examples are just about the only ones I've seen that show the 10-digit NDC in the human readable. Everyone else shows the 14-digit GS1 G10. So you might ask, what's going on here? Here is section 581.14 of the DSCSA, which says that the term product identifier means the standardized graphic that includes in both human readable form and on a machine readable data carrier that conforms to the standards developed by a widely recognized international standards development organization, the standardized numerical identifier, lot number, and expiration date of the product. Notice that it's the data carrier of the machine readable version of the product identifier that must conform to the standards developed by a widely recognized international standards organization like GS1. This is what allows us to encode the SNI as a GS1 G10 and serial number into a GS1 data matrix barcode. This is an extract from the FDA's SNI guidance from 2010. It shows that the SNI is a serialized NDC, or SNDC. And it says the SNDC is composed of the National Drug Code that corresponds to the specific drug product contained within a unique serial number, combined with a unique serial number. The DSCSA relies on this old SNI guidance to make this clear. So, in effect, that old guidance is extended by reference into the DSCSA itself. Here is the part of the SNI guidance that makes it clear how GS1 barcode and RFID standards may be applied to encode an SNI. It says, the use of an SNDC is compatible with and may be presented within a GS1 G10, which can be serialized using an application identifier 21 to create a serialized G10 or SG10 for use with RFID or for certain barcodes. Notice that this only affects how the SNI is encoded within the RFID or barcode data carriers. Of course, the DSCSA itself eliminates the use of RFID in favor of a data matrix barcode, but this guidance does not say that the human readable SNI can be depicted as a G10 and serial number. The point of this exercise is that regulatory requirements can be understood by directly applying language that is found in the regulations themselves. Now let's pause here and take a poll. So, how familiar are you with the regulatory requirements contained within the DSCSA? You have very familiar, somewhat familiar, familiar with some sections but not others, and not familiar at all.
Okay, we'll give everyone a moment. Just click directly on your screen to vote. We are about 40% voted. Another 10 seconds. And last chance. And we'll share these results.
Okay, so that's not bad. I've got 16% very familiar. Somewhat familiar is the bulk, is 42. Familiar with some sections, which is not surprising because most people just focus on the sections that apply to them, 23%, and only 19% not familiar at all. I think that's pretty good. Okay, business requirements are a little different. In most businesses, business requirements come from fulfilling customer needs, including those necessary to continue serving demanding customers. The reason a business chooses to meet a business requirement is to continue to attract customers. For example, a customer will usually demand some specific payment terms as part of their willingness to purchase from a supplier. In some cases, you might be able to negotiate terms that are attractive to both parties, but usually the customer presents it as a take-it-or-leave-it requirement, and this becomes a business requirement that the supplier must meet if they want to do business with that customer. There are lots of business requirements like this. Now we can finally define what a DSCSA triggered business requirement is. DSCSA triggered business requirements are business requirements that are imposed by demanding customers so that they are able to fulfill their own DSCSA requirements. This is really a combination of a DSCSA regulatory requirement and a business requirement. But it is your customer who is facing the DSCSA regulatory requirement, and so they can meet it, they impose a business requirement on you. That makes it DSCSA triggered. Here we see the sequence that leads to a DSCSA triggered business requirement on drug manufacturers that comes from a specific regulatory requirement imposed by the DSCSA on wholesale distributors. The DSCSA regulatory requirement on the left is imposed on the wholesale distributor, which leads the wholesale distributor to impose a new DSCSA triggered business requirement on their suppliers, the drug manufacturers. Time for another poll. Which websites do you monitor as part of your DSCSA program? FDA's DSCSA pages, the HTA or GS1 healthcare DSCSA pages, the DSCSA web pages of the big three wholesale distributors, a vendor's website, or RX trays. And you can click as many as that apply here.
Okay, we'll give you a moment to enter your vote. 35% voted. Last chance to click on your screen. And let's share these results.
Okay, so it looks like not everyone, I wish everyone would have clicked the FDA's DSCSA pages. They're quite good, particularly with their guidance. HTA and GS1 are excellent resources. The big three wholesale distributors, if you are a manufacturer, those are essential for people to monitor. A vendor's website, not very high, that's not too surprising. I like to see the fact that half the attendees have clicked RX trace. Thank you for that. All right. Okay. So here's an example of a DSCSA triggered business requirement. Electronic data exchange prior to November of 2017. The DSCSA specifies that the transaction data must be passed electronically from drug manufacturers to wholesale distributors beginning on November 27th of 2017. But waiting until then was too burdensome for the large wholesale distributors, so they imposed a business requirement on drug manufacturers back in late 2014 that said they would only accept electronic data from the very beginning. So starting on January 1st of 2015, DSCSA transaction data has been supplied to wholesale distributors electronically, even though the DSCSA would have allowed that data to be in paper form until late next year. This is a perfect and simple example of a DSCSA triggered business requirement. Here is another one, case label specifications. The DSCSA does not say much about the appearance of the labels on homogeneous cases. In fact, this is about all it says. The applicable data shall be included in a linear or two-dimensional data matrix barcode when affixed to or imprinted upon a homogeneous case. But to ensure efficiency in meeting the DSCSA, the wholesale distributors require uniformity in the labels on the cases they receive. As a result, their industry association, the Healthcare Distribution Alliance, recently published a document containing 16 pages of specific formatting requirements for drug manufacturers. Some of these are DSCSA triggered business requirements for those manufacturers. If you don't have that document, you can download it from the HTA website. Here is another example, aggregation data prior to 2023. The DSCSA requirement imposed on drug manufacturers that may require them to produce aggregation data for each shipment doesn't start until November 27th of 2023. But the big wholesale distributors are asking for aggregation data in 2018 so they can meet their DSCSA mandated handling of returned drugs in 2019. To drug manufacturers, this is a DSCSA triggered business requirement. To continue doing business with these companies, drug manufacturers will need to meet that requirement several years earlier than the DSCSA talks about. Now, I have an update on this. Last week, at the Healthcare Distribution Alliance Traceability Seminar, the HTA chose two different ways of meeting their DSCSA saleable returns requirement in 2019. One way was to receive the serial numbers of the packages within each shipment from the manufacturer, and the other was through a verification request router service that the manufacturers would support. We should hear from each of the big three wholesale distributors in the next month or two to see how this new development will affect their DSCSA triggered business requirements, but you can expect them to fine-tune. Time for another poll. Okay, are you preparing to meet the wholesalers' demand for aggregation data prior to November of 2019? The answers are yes fully, yes partially, no, or no, I'm not a DSCSA manufacturer.
Once again, this is the third out of fourth polls, so we'd love for you to interact. Please click directly on your screen. We're about 70% voted. Give it another 5 seconds. And let's share these results.
Okay, so starting at the bottom, 43% of those of you are not a DSCSA manufacturer, but 31% of the attendees on the call, of course, that would be a higher percentage if we were only talking about manufacturers on the call, but said yes fully, 12% said yes partially, and only 14% who are manufacturers said no, they're not planning on doing that. And that's not surprising either. That's kind of what the HDA is kind of expecting. They're not, they're recognizing that not everyone is going to be able to do that. So, all right. Now, just to be complete, I wanted to explain what aggregation data is. It is data that describes containment hierarchy based on serial numbers. It is the serial number-based parent-child relationships of the shipping containers, like pallet to case, case to inner pack, inner pack to unit, and if there are no inner packs, case to unit. It allows the owner to know which unit level serial numbers are contained within a given inner pack or case or pallet without tearing them down and opening them and reading each unit. That's important when you need to document which unit level serial numbers are being shipped or received, something that will be necessary after November of 2023, but will also be helpful to wholesale distributors before that. And last week, at the HDA Traceability Seminar, the wholesale distributors pointed out that for 2019, they technically only need the list of serial numbers included in their shipments, their incoming shipments, and not the full aggregation data. But for drug manufacturers to know exactly which unit level serial numbers are included in a given shipment, so they can notify the wholesale distributor, they would need to have the aggregation data and use it when the physical shipment is being assembled. Here are the three main phases of the DSCSA as faced by drug manufacturers. You can see we are currently in phase 1. Right now, the DSCSA requires members of the supply chain to exchange lot-based transaction data, but there is no product serialization requirement yet. Phase 2 starts next November. It will continue to require the exchange of lot-based transaction data, and it will require all drugs introduced into the supply chain by manufacturers to be serialized. As we all know, that's a huge step for drug manufacturers and their CMOs. Finally, phase 3 doesn't begin until November of 2023. That seems like a long way off, but a lot has to be figured out between now and then, particularly how things are going to work in that phase. This phase is the only one that has its own name. The DSCSA calls it the Enhanced Drug Distribution Security Phase, or EDDS. In the EDDS, the DSCSA will require the exchange of serial number-based transaction data for the first time. That's another big step. And the DSCSA is very vague about how it is supposed to happen. I think we can all expect a bunch of DSCSA-triggered business requirements to come from the wholesale distributors in the next few years targeting that phase. Here is one final example of a DSCSA-triggered business requirement. The orange line shows the extent of the regulatory requirement to exchange lot-based transaction data. It extends right up to November of 2023, which is when the data exchange must include the unit-level serial numbers. Today's electronic lot-based transaction data is universally being provided to wholesale distributors in the form of EDI advanced ship notices, referred to as ASNs. The DSCSA triggered business requirement is for a second parallel data stream to the big wholesale distributors that starts sometime in 2018. This second data stream is not mandated by the DSCSA, but because the large wholesale distributors are asking for aggregation data or the list of unit-level serial numbers in each shipment, this is how they expect to receive it. They expect manufacturers to provide that data in the form of GS1 EPCIS events, including at least commission events and perhaps also shipping and aggregation events. Right now, only one of the big three wholesale distributors will allow you to switch from lot-based data to a single stream of EPCIS events to carry the DSCSA mandated transaction data and the non-mandated aggregation data, or the list of unit-level serial numbers in each shipment, prior to 2023. The other two expect you to keep that data separate. The reason is that the exchange of the mandated lot-based transaction data is going smoothly at this time, and they don't want to disrupt that and risk being non-compliant. In that approach, any problems with the EPCIS data stream prior to 2023 does not elevate to a regulatory problem, and drugs can still be distributed. The need to provide aggregation data to the wholesale distributors early has been discussed a lot over the last year, but not many people are talking about this parallel data stream yet. Nonetheless, it is an important detail that must be at the forefront of any solution design. Now let's take another poll. Okay, which types of electronic data streams are you planning to offer to wholesale distributors prior to 2023? EDI advanced ship notices only, GS1 EPCIS events only, EDI ASNs then switch to GS1 EPCIS events, EDI ASNs and eventually GS1 EPCIS events at the same time, or none of these because you are not a DSCSA manufacturer.
Okay, we're about 50% voted. Last poll of the day, last chance to interact. Give it another 5 seconds. And share these results.
Okay. Now 44% of you are not DSCSA manufacturers, a little bit different. But I think the largest percentage we have there is ASNs and eventually EPCIS events at the same time. So that's the parallel path. Next higher one up from there is the second one, 15% said events only in EPCIS, and 12% said ASNs then switched to EPCIS events, which is very interesting results because EPCIS is only going to give ASNs. I think that's excellent results. Thank you. Okay, finally, if you are a company in the U.S. pharma supply chain, you need to take action now in order to remain in business in the coming years. Nothing less than your ability to remain in business is at stake. You need to learn, plan, and act. Study the DSCSA. Study your trading partner and contract partners' requirements or demands. Study the solutions offered by the various vendors, including Systech. Then draw up your list of solution requirements. Put a lot of thought into this step. Anything you forget to include will come back to haunt you later. Invite solution providers to propose solutions that meet your requirements. Please include Systech in that step. Create new SOPs and modify existing SOPs to incorporate serialization requirements. Then choose your solution provider. Work with your internal and external stakeholders to align your business around serialization and compliance. Okay, now I'm going to hand it back to Mirav while I take a look at your questions that we can answer in just a few minutes.
Okay, thank you, Dirk. As we are nearing the end of this webinar, We are going to switch over to Q&A in just a moment, so if you haven't had a chance to submit any questions you may have, please use the questions box on the right-hand side if you go to webinar screen to submit your questions now so Dirk can address those in just a moment. This session, just to remind you, is being recorded. We also will be providing a supplemental booklet in PDF form, which will provide you all of the details that Dirk covered during this session. So you may view the recording or the booklet. That should be made available to you before the end of the day today. Just to remind you, the session will close right on time, we hope, and a short survey will appear on your screen. It should only take you about a minute to complete, and we do appreciate your feedback. Our next webinar will launch on November 29th at 11 a.m. Eastern. We that is available on systech1.com/webinars. We do hope that you will join us and register for that webinar. And again, please stand by over the next couple of days. We will share registration for Dirk's webinar, Q4 quarterly update, as well as some regulatory topic, which will be made available for registration over the next couple of days. Now we'll switch over to Q&A. Dirk? Okay.
First question is, what is a verification request router service? And in fact, that's an excellent question. I mentioned the fact that at the HDA traceability seminar last week, that was one of the solutions that HDA had selected after their pilots. And not many people know what that is, and I didn't mention what it was. But in fact, that's going to be the topic of my December webinar that Mirov just mentioned. Because I want to explain it. It's something that's a little bit too detailed to go into here. So stay tuned for that. Please register for that webinar in December. I think it's on the 13th, if I'm not mistaken.
Correct.
Okay. And next question. Would printing a G10 only next to the 2D code be wrong? I like that. Now, in my presentation, and in other presentations I've done in writing on RxTrace, I point out the language of the law I think is fairly clear, although it does take a lot of gyrations to get there, that the law requires or is asking for the NDC to appear there. However, not many people seem to have come to that conclusion. As I said, most examples that people present show the GS1 G10 instead of the NDC. Others, I can say, at the HDA seminar last week, pointed out that the NDC is a requirement separately from the DSCSA, and that must appear, and all drugs generally have an NDC listed on the front panel of their labels. So the only real opinion about this that matters is what the FDA thinks about this, and they're not talking right now. Someday I'm sure they will. So at this time, I guess I encourage you to read that language and make your own decision about what is likely to be necessary, or wait until the FDA issues their thoughts around that. If you continue to just keep the G10 instead of the NDC next to the 2D code, you're going to be in the company of many companies out there. Lots of people are going to be doing that. So you're not going to stand out if you continue to do that. So, okay. Mirov, do we have?
We are out of time, unfortunately, for the day. We are getting great questions. So let me just ensure you that we have a team, including Dirk, who is on standby to answer all your questions. We will contact you directly over the next day or two and make sure all your questions are answered and see if you require anything further. Again, the slides, the recording will be made available, and you can contact us or Dirk directly with questions using his email on the screen. We do appreciate you joining us today. We do hope to see you again at future webinars. Have a wonderful day, everyone, and stand by for the survey. Take care.
Thank you.